I'm here at the Mahoning County Public Health District Environmental Lab, where I just took a behind-the-scenes tour, learning what the mosquito testing process is here in the valley and what that means for our residents. So far this year, mosquitoes have tested positive for West Nile in Boardman, Austintown, Poland, Beaver, and Springfield townships. I shadowed Colton Masters for a behind-the-scenes look at how that testing is done.
What they have to do is we have to apply a trap in place, but we have to put water underneath it, and not just regular water. It's got to actually have a bit of an odor to it. The stronger that odor is, the more mosquitoes we're likely to attract, because it gives a signal to the mosquitoes that that is a good spot to lay their eggs. When the mosquito flies to that water, they get sucked up and caught into the net. These traps stay in place for 24 hours. So it's not long enough for, even if mosquitoes had laid their eggs in there, they could not then hatch, because the traps get collected the next day and the water gets emptied. These traps are provided to us from the Department of Health at the state level, and they supply the same traps all across the state to any department that wants to do the work. So what we're doing here is, as they seal that up, that's creating almost a negative pressure with the fan blowing, and that's going to suck those mosquitoes up through the bottom, and then they'll be caught in our net, and that net is designed to hold them until we collect them the next day. This is the very beginning and the basis for our entire operation when it comes to collecting samples and collecting mosquitoes from around the county. This is like the first step for the whole thing.
Once those mosquitoes are collected, it's back to the lab. They're sorted and then sent to Columbus for state testing. Once the data is collected, it's put online.
It's worth noting that by looking at these sheets, we can see that we are by no means an outlier. Another part of the same page, where you'll actually see a map that shows up like this. This is an interactive map that people can then get on and see how many positive West Nile cases were detected in each county. While we have 5 samples, we are not the only county that has them. And frankly, like Franklin County, they have 120 samples. When they have samples that come back positive in those high counts or in counts at all, it's worth noting how many samples they've sent down. Franklin County and Columbus Public Health have far more interns than the two we have. They can submit many more samples. And that's where the general spreadsheet comes in at, because this will tell you how many samples they have submitted and what their general positive West Nile virus case is.
So what would be the least skewed data to look at? What would be the numbers that are most fair, or do you need to look at it comprehensively?
I would say you have to look at the whole thing comprehensively. There's a lot that goes into this. And again, not every district or health district is able to sample for mosquitoes. So it's not like you can say, well, this is of the entire state. This is of the 53 agencies that are actually testing. And it's a total of 40 counties out of the 88. So about half of the counties are actually testing for it.
Even though the mosquitoes are testing positive, as far as humans go,
so far we have 1 positive, and I pulled this map this morning.
In the whole state, only 1 positive
for the state,
people.
As far as I am aware, okay? And then they'll even break it down, they'll break it down based on age and by sex, okay? So they will tell you if we get more positives, how many males and females we had, what the general age ranges were. Human cases are reported to the state of Ohio and the local health districts based on tests ran that the doctor or your primary physician would order done. They tend to order that if they're trying to rule out mosquito-borne diseases for more severe cases or symptoms. If they do order that testing, the lab is required by law to send the local health district where the person lives and the state of Ohio that information.
And then that information will be posted online where the public can access it. The major message that the health district wants to get across?
Even though you see these reports coming out about West Nile virus positives in parks and in systems across the county, we by no means want people to avoid the outdoors. I want people to be outside. I want them to get exercise and fresh air. It's good for us to be in the outdoors.
Reporting from behind the scenes in Austintown, Laurel Stone, WKBN 27 First News.
Hi everyone, I'm Lindsay Watson. Thanks for watching the WKBN 27 First News YouTube channel. If you want more video news, subscribe to our channel. And don't forget to download the WKBN 27 First News app for breaking news alerts.